Tonight,
the mass was there and it wasn't going away.
An abc27 special presentation.
They removed her entire right middle lobe. I was so happy to know that she wasn't going to need further treatment.
Pediatric surgery. Hope, trust, and healing. Sponsored by Penn State Health Children's Hospital.
Good evening, I'm Deborah Pinkerton. Tonight is about hope, trust, and healing. Meet the pediatric surgery team at Penn State Health Children's Hospital and learn how the dedicated staff provides pediatric patients with skilled, compassionate, and comprehensive surgical care. And doctors will answer some important questions like, are robotic surgeries available for pediatric patients? What questions should parents ask when looking for a pediatric surgeon? And how do you prepare a child for surgery? And if you have questions at home, Denise McCracken is here to tell you how to get them answered. Hi, Denise.
Hi, Deborah. Yes, doctors with Penn State Health Children's Hospital will be with us tonight live answering your web chat questions until 8 o'clock. If you have a question, go to abc27.com/surgery-chat. And I'll be back later in the show to share some of those with you. Deborah.
Thank you, Denise. A Dauphin County couple got to know the staff at Penn State Health Children's Hospital very well. They spent 2.5 months there. June and Matt Hackenberry share their journey. Meet 10-month-old Danica and Zoe Hackenberry, identical twins who are very busy.
They're starting to get around in their walkers. They're loving every time you pick them up to touch and grab everything on your face. You know, they're at that point where everything they see gets grabbed and goes into their mouth.
As you can see, they're definitely interested in toys. They are crawling. They're rolling everywhere. They're just very active 10-month-olds.
That is now. June and Matt share how their journey began.
It was probably 1.5 to 2 years that we tried with fertility help, and it just didn't happen. And I was so tired of the roller coaster, the emotions every month.
I always told my wife, I said, by the time I hit 40, it's going to be too late to keep trying. I'm going to be too old. Well, I turned 40 in August and found out she was pregnant in September.
Had no inclination that I was pregnant. I didn't believe I was pregnant. Even after the pregnancy test at home, I didn't believe I was pregnant.
A blood test confirmed June was pregnant.
I was shell-shocked because of the long road it had been trying to conceive on our own, but I was extremely excited at the same time. You know, I was ready to be a dad.
Another surprise came a couple of weeks later during the first ultrasound.
I looked at the screen and I said, something's not right. That doesn't look right. There's extra things in there. What's wrong with the baby? She said, honey, that's because there's 2 in there. How'd that happen?
As soon as we found out that it was twins, my wife is extremely small, so we knew it was going to be a very, very high-risk pregnancy.
And Matt was right. At 27 weeks, 6 days, the twins were born. Danica weighing in at 2 pounds, 2 ounces, and Zoe 1 pound, 13 ounces.
So it was just disbelief. And then to look at them, how tiny they are and how fragile they are, I was blown away.
I'll be honest, if you'd ask any of the nurses and people, staff down there, I basically sat outside the door weeping because I couldn't just believe how many people were dedicated just making sure that my 2 girls came out all right.
The NICU staff spent 10 weeks taking care of the twins. You
get to know everybody. You learn everybody's names, and you just get to know everybody, and you talk to them, and they're happy to answer any questions. And as a first-time twin mom and preemie mom, I had a lot of questions.
They told us it was going to be a lot of ups and downs. They said, you know, every 2 steps forward, you're going to take 1 step back.
A step back came when doctors discovered a mass in Danica's lung.
They thought that she had actually gotten pneumonia for a little bit while she was in the NICU, so they thought it could have just been congestion related to that.
Doctors treated her with antibiotics and kept checking the mass after she and Zoe went home from the hospital.
It wasn't going away, so that's when they started to talk about, you know, it may be cancerous, it could be anything. We had no idea, so we were basically informed at that point it would be in our best interest to have them remove the mass to get it tested.
At 4 months old, Danica had surgery.
They removed her entire, it was the right middle lobe, did the biopsy, it came back, it was just a fatty type of tissue that just ended up growing.
To know that it wasn't cancerous, and to know that after so much of an ordeal that she had been through in such a short time of her life, that this was one thing that she wouldn't have to worry about. We could all breathe a sigh of relief after that.
Danica and Zoe are off to an amazing start.
They are doing extremely well. They look like two happy, healthy little babies, and they're developing just as expected for being born that early.
It's just amazing about how they started and where they are now. I have to be honest, my girls are absolutely adorable.
And they certainly are adorable. June and Matt are proud parents who are forever grateful to the staff at Penn State Health Children's Hospital. They cannot thank the team enough. And here with us is Dr. Briana Emmer, pediatric surgeon at Penn State Health Children's Hospital, and also Danica's doctor. Thanks for being with us.
Thanks for having me.
What an amazing story. How common is this type of surgery?
Congenital lung lesions in pediatric patients are fairly rare. There's only 1 in 1,000 live births that have a congenital lung lesion, but we do perform about anywhere from 10 to 20 of these surgeries a year to remove part of the lung that is either benign or sometimes malignant.
And fortunately, hers was benign, doing so well. As I had mentioned, the Hackenberrys are so grateful to the team at Penn State Health Children's Hospital. How does it make you feel to know that they are doing so well today?
Well, that's the highlight of my job. I love having a happy ending to all of the difficult surgeries and time that we put in. And, you know, we train really hard to be able to take good care of patients of all sizes, from the very smallest to even college age kids. And when they do well, it's amazing.
Yeah, certainly. And I imagine it must have been such a difficult time for Matt and June when they were going through the process, the fact that the babies were born so early and then just every step of the way and then surgery. How do you explain to parents what's happening, and how do you ease their fear when their child needs to have surgery?
Yeah, it's a tough thing. I oftentimes will tell the parents that I have children as well, and that when they come into the hospital, I want them to have the best team taking care of them. And I really do say that I'm proud of the team that I work with, and we do everything children-centered, and that's why they come to us.
Now, you are an expert in minimally invasive pediatric and robotic surgery. What are some examples of when these procedures can be used on children?
Yeah, minimally invasive surgery in pediatrics has come a long way. There were days when everything was done with a big open scar, and now we do everything from appendicitis to complex liver reconstructions to lung operations with just tiny scars, and patients go home in a matter of days as opposed to a week or so.
And I know that's what June said. The scar on Danica is so small. She's like, she's never going to see it. So yeah, that is certainly good news. What are the benefits of robotic surgery, and what do you think the future really holds?
It's interesting. It's definitely a growing field, and so I'm excited to be a part of it where it's developing, but there's really a lot more fine dissection that we can do with some of the robotic instruments, and we have 3D vision as opposed to 2D in laparoscopic surgery, and it's really taken off, and so I'm excited to see where it goes.
Yeah, very exciting, a very exciting field. Thank you for all you do.
Thanks.
And thanks for being with us tonight, Dr. Emmer. And if you would like more information about the surgery team at Penn State Health Children's Hospital, or if you would like to make an appointment, visit online at pennstatehealth.org/children's, or you can call this number 717-531-8342. Let's check in with Denise McCracken. What are some of the questions being asked tonight?
Thanks, Deborah. We have a wide variety of questions coming into the live web chat tonight, and joining us is Dr. Anthony Sai. He is a pediatric surgeon with Penn State Children's Hospital. Thank you for joining us tonight.
Thank you. It's my pleasure.
Our first viewer question is, what kind of training is required to become a pediatric surgeon?
To become a pediatric surgeon, it does require specialized and rigorous training. It starts with 4 years of medical school, and after that, it requires 5 years of general surgery residency. And then it goes on to 2 years of pediatric surgery fellowship for more rigorous training and hands-on experience in treating these kids.
A lot of extensive experience required.
Absolutely.
Our next viewer asks, sledding accidents can be pretty scary. How can we prevent trauma from happening with our kids in the snow?
Yeah, We all want our kids to enjoy sledding, and at the same time we want them to be safe. Some of the recommendations we have are to make sure that they are well dressed and make sure they're warm, and also to make sure they have a helmet on when they go sledding. We also recommend that they use age-appropriate sled that they can control and steer, and also to pick appropriate setting for their sledding activities. That includes to avoid areas that have rocks, trees in the way, and to avoid going into the street or into a lake or a water body.
A lot of great tips for parents and kids. Thank you.
You're welcome.
If you have a question at home, go to abc27.com/surgery chat. Stay with us. We'll be right back.
The best teams attract the best talent. That's true on the football field and beyond. As Penn State Health opens new locations across Central PA and delivers superior care at its existing hospitals and clinics, it's looking for talented people from all backgrounds to fill positions throughout the organization. Think you got what it takes to join an exceptional healthcare team? Apply today at pennstatehealth.org/careers.
You're watching Pediatric Surgery, Hope, Trust, and Healing on abc27, sponsored by Penn State Health Children's Hospital.
Welcome back. Joining me is Allie and Parker Minetti and Dr. Adi Fahy, Director of Pediatric Surgery at Penn State Health Children's Hospital. Thanks for being with us. Allie, why don't you talk to us about Parker's situation?
Okay, so it was back in February of last year, and we had gone into Hershey Hospital to have an x-ray of his abdomen. When we came in a few weeks past that date, the doctor actually started talking to us about his lungs instead of anything in his stomach area. And they were hypothesizing that he had a collapsed lung. It turned out to not be that at all. The way Parker said it was that it wasn't actually something that was less than, it was more so. So it was a very large mass in his chest. Very rare, and yeah.
Wow, very scary. Parker, you're 11 years old. I can't imagine going through something like this. What was your reaction?
I was worried, but also really surprised. I didn't think that was going to happen when you're going in for an appointment like that.
Yeah, I can't imagine it. Allie, so you had to make some tough decisions.
We did. We had met with Dr. Fahy pretty early on in this journey, we'll call it. And we went through a litany of tests, basically anything that we could have done, we had done. We also researched other hospitals and came to the conclusion that we were in very educated and capable and loving hands. Just felt very grateful that Hershey was so close to our home, and we made the right decision sticking with this team. Surgery turned out really well.
And Parker, when they're talking surgery, you're like, oh my goodness, I was just in school. You're talking about surgery? What were your thoughts?
I was surprised and bummed about missing baseball.
Baseball, okay. You're thinking the right thing.
Always baseball.
Dr. Fahy, what type of surgery did you recommend, and what were you thinking was inside of him?
So we knew that he had a large mass that overlaid his heart, but with all of our various workups and our echoes and imaging studies, and with our wonderful peds radiology team at Penn State, we were able to kind of think that this was a likely benign mass coming from the thymus, which overlies the heart. And I felt like we would be able to offer a safe resection for Parker with our robotic technology and get him back to playing baseball a little sooner.
So why don't you tell us, how did the surgery go?
So thankfully the surgery went really well. We were able to separate the mass from the heart, and avoid causing injury to any of the other big important things in there, and get it out through a very small incision, having put it into a little bag. We were lucky that we have a wonderful team of peds anesthesiologists and fabulous nurses who were all very happy to take care of Parker, and thankfully he did really well. We have a great I definitely felt like this was a very complex surgery, and I was grateful to know that I had other wonderful ped surgery colleagues and our adult thoracic surgery colleagues around, and that we really had an infrastructure where we could offer him really good, safe care.
And Ellie, I saw you breathing deeply. I can't imagine, I know you had mentioned that it was a long surgery.
Yeah,
it must have been such a huge sense of relief.
Huge. Almost impossible to even talk about now, although I know other families go through things that are even worse or even more difficult, but I think from beginning to end the surgery was close to 6 hours. So from the time I was able to walk him into the operating room and then sit as patiently as possible in the waiting area until Dr. Fahy came down to tell us that it was a success and that he was doing more than fine.
And then you found out, how long did it take before you found out?
I think it was, now this felt like a really long time. It was a matter of weeks, but it felt like months, waiting to see if it was in fact benign. And it was, thank God. And then on to the healing process.
And the healing process for you, Parker, how was that?
It was good. I was happy that they got to go through the side instead of the chest, so I got to get back to all my activities sooner.
And baseball.
Yeah.
And doctor, tell us, how does it make you feel to see Parker sitting here? He's doing okay. He has his baseball cap on. He's back to playing baseball. Yeah. And mom is breathing huge sighs of relief.
I know. So it's a real privilege to take care of children like Parker and to be able to kind of walk them through these terrifying events, you know, in their young lives. We do a lot of training and a lot of kind of long hours and long years to kind of be in a position where we can be able to offer these complex surgeries, and it feels like a blessing to be able to kind of be part of a team and an infrastructure that we're able to offer these and take care of such special kids like Parker.
Thank you all for being here and sharing your journey. And Parker, good luck to you. Good luck with your baseball season.
Thank you.
And if you would like more information about the surgery team at Penn State Health Children's Hospital, or if you would like to make an appointment, you can visit online at pennstatehealth.org/children's or call 717-531-8342. Let's check in with Denise and get some answers to more of our questions.
Thanks, Deborah. Well, back with us is Dr. Anthony Sai, pediatric surgeon at Penn State Health Children's Hospital. Our next viewer question is, how can I prepare my child for surgery, and how much information should I share about what's about to happen?
Sure. Preparing a child for surgery could be challenging for both the child as well as the parent or parents. And it is tricky to find a fine balance between giving them too much information and giving them enough to alleviate their anxiety. We recommend by being honest with them and explain to them why they need to go through surgery and what to expect on the day of surgery. If parents have any questions about that, we're always available to help. And when you come in for consultation, we will go over those information as well. When you guys go home, please explore with the child to see if there's any questions that they have that can induce anxiety, and reassure them that they have the best team available to take care of them. When you guys come in on the day of surgery, we also have child life team that can help with alleviating some of the anxiety for the patient, and they have books and other props that they can use to help explain some of the things that they may have questions about.
That's wonderful. It can be quite a scary time for families.
Absolutely.
Our next viewer asks, can you tell us about your pediatric emergency room, and when should a child go there versus urgent care or their pediatrician?
Sure, that's a great question. And our emergency room is designed to take care of critical illnesses and severe injuries. And sometimes it's difficult to know when to come to our emergency room versus other places. We usually tell people a general rule is that if there's anything that's emergent or critical, such as fractures, injuries, head injuries, bleeding, and anything similar to that, or severe burns, they should come to our emergency room. In addition, any critical illnesses such as fever that's refractory to home treatment, dehydration, and other illnesses that they are not able to handle at home, they should come to our emergency room. Parents have any questions that they're not sure about whether they can take take their child to the emergency room, we recommend that they touch base with their pediatrician because pediatricians usually know them very well, and also a good gateway to tell them when they should seek higher level of care.
Great, excellent advice tonight. Thank you so much for answering our questions. The doctor will be here until 8 o'clock tonight. There's still time to send in those questions. Go to abc27.com/surgerychat to submit your question. Back to you, Deborah.
Thanks, Denise. Here with us is Dr. Thomas Samson, Surgeon-in-Chief at Penn State Health Children's Hospital. Thanks for being with us.
Thank you.
Doctor, you lead the team of incredible surgeons at Penn State Health Children's Hospital. Talk to us about how the team works together to provide the best pediatric care.
Well, I think the examples we were shown tonight serve a good purpose to get to that end. We have very complex patients. We also have pretty simple patients, but all of them get treated at the highest level with experts across the way. And so the team that we have in pediatric surgery covers the gamut. So we can provide any service that any child needs across the board. And I think that's an important thing. Sometimes I think we have families and folks that overlook what's right in the back door. And so it's wonderful to be able to provide care for someone like Parker and the family and the twins, because it underscores what we have and what we can provide for them.
Now, Penn State Health Children's Hospital is a Level 1 children's surgery center, and it's recognized by the American College of Surgeons. It's quite an honor. Yeah,
that's absolutely true. It's a very important distinction. We take a lot of pride in that. What that means to be a Level 1 CSV hospital means that we can provide at each touch point for these children specialty care that is specific to them across the board. And so that means not just pediatric surgeons as we've seen tonight, but pediatric anesthesia that makes sure your child is safe if they're having an MRI that they need anesthesia for. We have specialists across the board for lungs and kidneys and the like. And if you as a parent know that you can get that level of training and care for your child across the board, I think it provides a level of comfort that is really hard to beat.
Yeah, and that's certainly what parents want to hear.
Yeah.
Now, your services, your pediatric services, surgery services have recently expanded throughout our region, particularly in Lancaster County. Talk to us about that.
Yeah, so I'm very happy to speak about that. Tomorrow, in fact, is our first day that we're going to be doing some elective pediatric surgery at our Lancaster Medical Center, which are one of our new hospitals. And we've been working to essentially provide the children's hospital experience at our outside hospital. And we think it's critical to present the entirety of that mission and not just going out in a piecemeal fashion. So tomorrow we'll be able to provide pediatric anesthesia. We'll have pediatric trained nurses pre and post-op, and of course pediatric surgeons providing that service. But now it'll be bringing that out to where our patients are. And so we're going to try to do that as a health system and focus on that at all of our other hospitals to, again, provide that service closer to our families and make things a little bit easier for them.
Now, we know with children, accidents certainly do happen. Talk to us about the Pediatric Trauma Program.
Sure, that's another real important designation. And it takes an entire team to be able to get that level of care. So that distinction means that a child, regardless of the complexity of the trauma, will be getting the highest level of specialty care when they come in the door. The other piece that I think is important is Penn State provides the only Level 1 trauma center in the mid-state, and the state for that matter, that has both adult and pediatric Level 1, highest level care in an emergency trauma situation right there. And so what that means for families is if, unfortunately, if a family is involved in an auto accident and there's children in the car, they're not going to get separated and sent to different hospitals where they're not next to each other. They actually will be sent to the same trauma facility and actually be recovered essentially next to one another. And we think that's a very important distinction, especially if you can imagine being in a situation like that, to be able to be close to your children and keep the cohesiveness of the family together.
Yeah, that would be very important. Talk to us about when parents are looking for a pediatric surgeon, what questions should they be asking? I mean, just thinking that they have to do something like that is daunting, but then making sure they know the right questions to ask.
I think Allie kind of demonstrated that very well with Parker. She went through this process herself and was very thorough. We were talking a little bit about this, and she mentioned how she researched hospitals, that she had friends back in California and in Phoenix, and really did her due diligence. And at the end of the day, as a parent, I think what we owe to our children is to be able to say with a level of comfort that while this is a scary process, I'm going to a facility, a hospital where I have people that have put in the hours, have put in the time, and can take care of our child to the highest level and degree. And it's not just the surgeons, but it's the nurses in the operating room, it's the nurses recovering them, it's the surgical technologists getting us our instrumentation, it's the people keeping our operating rooms clean and keeping the sterility at the highest level. None of this can happen with just one part of that puzzle. It has to be a team. And so I, with a lot of pride, am happy to be a Penn State Health employee where I'm one piece of the entire team. And I think that's what we all strive to do, and to be able to provide care that would allow Parker to get back on the baseball field as quickly as he did.
Yeah, that's great news for him and great news for the twins. Dr. Samson, thanks so much for being with us tonight.
My pleasure.
And we also want to send a special thanks to the Hackenberry family and Allie and Parker for sharing their stories, and you, our viewers, for sending in your questions. If you would like more information about the surgery team at Penn State Health Children's Hospital, or if you would like to make an appointment, you can visit online at pennstatehealth.org/children's or call 717-531-8342. And on Friday, February 9th, there will be a special Good Day PA. Learn about Four Diamonds and its mission to conquer childhood cancer and get a sneak preview of Thon 2024. Once again, that's February 9th on Good Day PA at 10 o'clock right here on ABC 27. We want to thank you for watching tonight, and we wish you good health.